Hello and welcome to another V podcast. We have watched in awe the dedication of professionals of various fields, be it the medical and health services, law enforcement force, policy making and governance sectors, or the various persons manning the media, trade, and economic affairs. We have lauded and praised their diligence, unconditional sincerity to work, and selfless service. Has this pandemic, however, affected men and women differently? The understanding that we have about differences and implications due to gender has been shaped by our own experiences and by the knowledge gained through media. But have we seen the full picture? How far have women contributed to this global fight against what seems to be an uncontrollable enemy? There are various reasons why women in positions of leadership have been largely successful in efforts to manage the present precarious situation. And yet, there are contrasts and paradoxes that are evident in this scenario. Miss Nisha Leela Jose, Assistant Professor, Department of Commerce, speaks about the contribution of women in frontline efforts, the challenges they face, and the need to equip them with skills, training, and opportunities to beat COVID-19.
Defying the traditional concepts of social expectations where women need to be soft and sweet, the ones in power and authority today successfully gel and handle the paradoxical traits of being demanding yet caring, authoritative yet participative, and inaccessible yet approachable. These are the three essential challenging hallmarks women of leadership need to possess. Competence and toughness are naturally ascribed to men, and they are therefore considered as a better choice for administration and governance, which is a myth that was exploded when COVID 19, with all its far reaching repercussions and ripples, continues to hold the world to ransom. Against the backdrop of a world ravaged and incapacitated to the point of dysfunction by the outbreak and the devastating spread of COVID 19, the leadership qualities of women as government heads and the effective roles they have played in stemming its transmission cannot be lost sight of. Countries like Germany, Norway, Denmark, Iceland, Finland, Taiwan, and New Zealand have been able to handle this pandemic with convincing maturity, foresight, and effective crisis management. Many of these leaders have been able to place the interests of the global community ahead of economic, social, and political gains. Early research, testing, and dissemination of vital information to the public, and restructuring of healthcare services immensely helped in tackling the appalling situation. Some even reached out to children and youth through chats and helped them handle the situation the entire world was unprepared for. By the end of February, leaders across the globe were looking at the same facts. An invisible and dangerous enemy was fast approaching. COVID 19 was highly contagious, unpredictable, and deadly, even with an aggressive public policy response in China. So, how to prepare and respond? This was an unprecedented test the leaders of cities, states, and countries faced. The ones who passed this test with flying colors are disproportionately women. This is despite the fact that they make up only 7% of heads of state. In some ways, this moment in history offers a fascinating and real time opportunity to understand the consequences of leadership decisions in high stakes situations. It all comes down to when governments enforced physical distancing. Cities, states, and countries that implemented a clear, thorough, and well executed social distance plan at least a week before their first death had radically different outcomes. In short, they flattened the curve and controlled and prevented new cases. Why do we need women to lead health emergency situations? Women constitute the majority of frontline healthcare workers worldwide, which is a fact indicative of their innate competence and dedication. It, however, stands in stark contrast to observe that globally, only 20% of the senior leadership positions are held by women. Already, women make up the bulk of the world's health workers, sharing the burden of strenuous work while increasing their own risk of infection. With the novel coronavirus, women have played a prominent role. Take China, where 90% of the nurses and nearly half the doctors are females. While early studies suggest that men carry a higher mortality rate from the coronavirus infection than women, women too are likely to be disproportionately affected in many ways, from the impact of school closures to a growing need for care of the sick and the old at home. We must also address the challenges women face as a result of prolonged quarantining, such as spikes in domestic violence and other psychological setbacks. Health emergencies impact men and women differently. Sometimes the impacts are obvious, as was the case with pregnant women in the Zika outbreak. Times of crisis can exacerbate gender inequalities like access to paid work or women's vulnerability to poorer health, as had happened during the 2014 Ebola outbreak, where resources diverted from obstetrics care contributed to a spike in maternal deaths. As the virus continues to spread, governments, research labs, and healthcare facilities should commit to ensuring that women in leadership are not the exception but the norm. More broadly, we must build systems to support women's leadership in global health before the next disaster strikes. We can do this by equipping women with the skills, training, and opportunities to rise to the top. The activities and the initiatives of the Women Political Leaders WPL, a global networking platform for female political leaders at national level, go a long way in empowering women, and their recent activities in fighting this coronavirus pandemic bear testimony to promises for a better tomorrow. Based in Reykjavik, Iceland, a nation known to champion gender equality, WPL is an independent, international, post partisan, and not for profit foundation with the distinct objective of demonstrating the impact of more women in political leadership. The crisis management of the highest order and magnitude set in stone the unquestionable maturity and foresight women leaders displayed in the face of a calamity of such scale and devastation. Many women acted first and made the bold and unpopular call to shut down life as we knew it in the face of a truly invisible enemy. So, social scientists and people who write about leadership, human behavior, and gender differences need to dig deeper to envision a safer and a healthier world ahead. Thank you.
That was truly an enlightening podcast, giving a brief presentation of women leaders and the fight against the present pandemic. Thank you, Nisha ma'am, for sharing your perspective and understanding with us.